Hello friends, let us now learn about the barium meal. In the barium meal, let us now learn about the conventional single contrast study of barium meal. Conventional single contrast study of barium meal. So in this conventional single contrast study of barium meal, it is definitely conventional. Here actually it is conventional, so it is done at 80 to 90 kilovolts. Okay, next in erect position. Okay, it is done at 80 to 90 kilovolts. It is done at erect position. First, in erect position, we have to visualize the base of the diaphragm and the domes of the diaphragm. We should visualize the domes of the diaphragm and the lung bases also. In erect position, we will first do an X-ray. X-ray of erect abdomen is done, and with this we will visualize the domes of the diaphragm and also the lower lungs fields. If there is any consolidation or if there is any type of pathology, we can detect it. And lower lung fields, or we can say the bases of the lungs. Okay, and then you will also have to see the intestines. Here you will see all the loops of the intestines should be seen. These intestines should be noted for any air fluid levels. Okay, so first you will do an X-ray in erect position. This is nothing but erect abdomen. An erect abdomen is obtained first. So this is the first film is first we have obtained erect abdomen, and in the erect abdomen actually we should also see the domes of the diaphragm also, but this is not visible in this X-ray. But we should make sure that we see the domes of the diaphragm and also lung bases, and also we should see the air for any air fluid levels first. Then followed by this, we will have to do a 10 to 15 ml. We should give 10 to 15 ml of 80 to 100% weight by volume of barium suspension is given to the patient. Okay, followed by which the patient has to swallow this. Okay, once the patient swallows this, now the esophagus we will have to see with fluoroscopy. Now the patient is put horizontal. Followed by this, the patient is lying in supine position. Okay, and right side should go up. First, he should be kept in supine position, and now the patient is rotated with right side going up. He should be in supine position and then rotated in such a way that right side should go up. Okay, and slowly right side going up, and slowly the patient is rotated clockwise direction. Completely, he should be rotated clockwise direction. That means first the patient is in supine position, then right side up, he should be turned to right side up, and then he should be rotated clockwise direction. Next. Next we will have to do what do we say? We will have to do an X-ray is taken. Okay. X-ray is taken and you should see whether the mucosal coating is good or not. First here, once he swallows, we will have to take an X-ray to visualize the esophagus. For visualizing esophagus, we should take X-ray here, and followed by it, once we rotate the patient clockwise, has seen at foot end. At foot end, we should see as if the patient is looking clockwise. So he is rotated, and we will take an X-ray again. We will have to see the mucosal coating is adequate or not. If the mucosal coating, that is mucosal coating of stomach we are talking about, if the mucosal coating of stomach is not sufficient, it is not adequate, that is if mucosal coating is not sufficient, mucosal coating is not good, is not sufficient, then we should again roll the patient again. Then again we should roll the patient in the same direction. That means we will have to roll the patient again in clockwise direction. Okay, that means again when the patient is lying supine, you will have to rotate in clockwise direction. Okay, then after that again you should take an X-ray again. Okay, now the patient is still lying in supine position. Okay, and now you should give the patient 100 to 250 ml of barium is given. Okay, and now you will again take the films, X-rays. Okay, X-rays first of X-rays are taken which is filling the fundus first. First you will take the X-rays which is filling the fundus, and this is taken with different oblique views. You will have to take an oblique views for this filling the fundus. Then again the table is in horizontal, and now the patient is turned to oblique right side dependent. Now the patient is in supine, right? Now he is turned to prone position. Prone position, and he is put in oblique view with right side dependent. He is turned in prone position, oblique view, right side dependent. And when you put the patient in this position the barium will enter the duodenum. Okay, and now you will take the films. And here films are taken. And if you take the films, X-ray films here, then you will see the duodenal bulb is visualized at this position, and also C loop of the duodenum is also visualized. Now the patient is again turned supine. Now again the patient is turned supine and the table is made erect. Okay, now you can again take X-rays. Again X-rays are taken in right. Yeah, again you can take the X-rays anyways. One important thing is that for this duodenal bulb and C loop, for taking films in duodenal bulb and C loop of duodenum, we should mostly do it in right anterior oblique position, because these are better visualized in this position, right anterior oblique position. Now next, if you wanted to distend the stomach more, you can give more barium. Now after all this is what you do. These X-rays are taken. Now you can give more barium, can also be given if you wanted to distend the stomach wall. If you wanted to distend the stomach wall, then you should give more barium. And if you wanted to see the mucosal folds, because stomach has some mucosal folds, especially we have rugae in the stomach, right? So for this mucosal folds, you should give graded compression, and by giving graded compression, we should take spot films are taken. Spot films of X-rays are taken while giving graded compression. Patient is also rotated in such a way that you should make sure uh, you should not miss anterior or posteriorly placed lesions. Any anteriorly or posteriorly placed lesions should not be missed in the stomach. So this is one important thing which you have to keep in mind. Then if you take the patient in erect view, in erect position, if you take right anterior oblique view, in erect position, right anterior oblique view, this will show incisura angularis. Incisura angularis is seen in right anterior oblique view. Along with that, we can also see proximal jejunum also. Okay. Then we also have retrogastric space. What is this retrogastric space? That is the space behind the stomach. So for retrogastric space visualization, we should give 200 to 250 ml of barium is given. For retrogastric space visualization, we should give 200 to 250 ml of barium is given. And in supine position also we can demonstrate for retrogastric tube. After giving 200 to 250 ml of barium, we can keep the patient in supine position. We can keep the patient in supine position, and then we can keep the patient in supine position, and we can take a translateral film, and this translateral film will show us the retrogastric space. Okay, for this retrogastric space, we should keep the patient in supine position and take a translateral film. Okay, but okay, this is the important. These things we can see in single contrast film. But what is the disadvantage of this single contrast study? If you do a single contrast study, the main disadvantage is we will miss the single contrast study will miss small mucosal lesions. It misses small mucosal lesions like polyps, or if there is any early carcinomas. So small mucosal lesions like polyps and early carcinomas are missed by this single contrast study. But one important advantage is that these small mucosal lesions and polyps, these can be demonstrated or these can be seen by using a single contrast. Definitely it is also single contrast, but by using high kilovolts technique. By using single contrast high kilovolts technique, we will not miss these lesions. Actually, if you see the normal um, conventional single contrast study, it is done at 80 to 90 kilovolts. But if the same it is done at high kV, that is high kilovolts, then we will not miss these small mucosal lesions also. So let us learn some important points about single contrast high kV technique. So in single contrast high kV technique, barium sulfate of 30% weight by volume is used. Here, radiology or this fluoroscopy or X-rays are mainly taken at 120 to 130 kilovolts, which is definitely more than normal conventional single contrast technique. Now, with this single contrast high kV lesion, kV technique, we can diagnose or we can detect the small mucosal lesions like polyps also. These can detect small mucosal lesions like polyps. So this technique will help in visualization of lesions. That is, it helps in visualization of small mucosal lesions, or even smaller lesions can be seen. Okay, next. What are the advantages of single contrast studies? Okay, the main advantage of single contrast study is single contrast study is mainly good for patients. It is good for immobile patients or for patients who are not able to swallow gas tablets. If the patient is not able to swallow gas tablets, because in double contrast technique we should ask the patient to take gas forming tablets. So if the patient is not able to swallow gas forming tablets, or if the patient is immobile, in them we can use this single contrast techniques. In single contrast technique, pyelorospasm, that is sudden contraction of pylorus, or presence of any types of fistulae, or if there is enlarged gastric rugae, so pylorospasm, fistulae, enlarged gastric rugae, these are actually best seen with the help of the single contrast studies. Then even some of the filling defects which can be due to any masses in the pylorus, or if there is any mass in the duodenum, okay, or any mass in any region, these can be more identifiable with single contrast lesions. So these are better identified or better visualized, better detected by single contrast studies. So this is actually the best procedure for, or it is a procedure of choice for suspected gastric or duodenal obstruction. If you suspect any gastric or duodenal obstruction, the single contrast study is the best study. Now, okay, this is good. Then what are the disadvantages? Disadvantages of single contrast study. The main disadvantage of single contrast study is it does not have the necessary sensitivity for very small lesions. So it cannot detect if there is any small erosion, or it will not detect presence of any small ulcerations or linear ulcerations. It cannot detect if there is any superficial gastric carcinomas. If there are any gastric carcinomas, if you see gastric carcinomas can be divided into superficial and deep. Okay, the superficial type can be diagnosed with the help of this, cannot be diagnosed with the help of single contrast study, because the superficial lesions will mainly involve the mucosa and submucosa. Okay, it will not involve even some muscularis. These are not seen as polyps. These are just small mucosal and submucosal lesions. So as a result, these cannot be detected with the help of single contrast studies. Even some small or subtle, very small, subtle or small mucosal anomalies can also be not diagnosed with the help of the single contrast study. Thank you for watching.